Good evening, friends. In the last video, we had discussed certain vital information regarding the fatty liver. And in today's video, we'll focus on the treatment part of the fatty liver. If you go to any allopathic doctor, you will see doctors normally prescribe certain drugs which includes urologicolic acid or saragulitizar or vitamin A. It depends upon the choice of the doctor or the condition of the disease, and your doctor is best to prescribe these medicines, and he will do certain preliminary tests which include the test for the what we call he will do the test such as lipid profile, the hepatitis test, and your doctor is best judge to decide these medicines. So please consult your doctor before taking any medicine. Let me add there is a vitamin called vitamin E, which has very important role in the fatty liver. Vitamin E normally prevents inflammation of the liver and degeneration of the liver cells, and is prescribed worldwide for maintenance of the health of the fatty liver. Its anti-inflammatory role is very important for maintenance of the liver health. Let me decide one more aspect of the fatty liver, that is high level of triglyceride. Normally it has been seen when there is a high level of triglyceride, it is reflected, and if you go for the ultrasound, definitely there will be ultrasound will show the fatty liver. So in that case, it's very essential that you take the medicine for the triglyceride. That has been normally the medicines, usually statins, which are prescribed for the triglyceride. They take care of the this aspect of the fatty liver, and over the period of the time, fatty liver can also get cured by taking simply these statins, which for the triglyceride. Then there is one hepatitis C or hepatitis B virus. Your doctor will definitely, if you have this chronic problem, or if you are suffering since long, doctor will definitely do the test for hepatitis virus C or B. Let me add, if you remember, in 1982, Amithab Bachchan suffered a very dangerous accident at sets of the Kuli, Mui Kuli, when he was punctured by the actor Puneet Isar. After that, after certain years, since he received large number of blood donations, large number of people flooded to the hospital to donate their blood. And after about 20 years, Amithab Bachchan discovered that he had developed the liver cirrhosis. What was the reason? The reason was that some of the person who had donated was suffering from the hepatitis B virus. This was disclosed by Amithab Bachchan himself in 2015 in a press conference. So currently he has only 25% of the liver, and the rest of the liver is damaged, but he is still surviving because the liver is the only organ in the body which has the capability of regenerating. Even if you are left with 5% of the liver, it can regenerate to the original size. So, as I said at the outset, your doctor is best judged to see every aspect of your fatty liver. So please consult your doctor regarding any medical treatment. As far as non-medicinal treatment is concerned, I shall say in this video we shall mostly focus on the non-medicinal aspect of the fatty liver. I am reminded some few months back I went to a friend of mine who is a doctor, and when I saw his 17-year-old child, he was just looking very thin and frail. I asked him, why is he your doctor? You are treating other people. Why don't you treat your son? Doctor said he refuses to eat. I said, why? Doesn't he have hunger? He said, no, he has good hunger, but he deliberately eats less food. He cites when because of our sedentary life, when it is not utilized, why should I eat? So there was a weight in what the boy was saying. So he used to eat less. So I think for a 70-year-old lad, this was too much. But there is a lesson for we adults. So first lesson is that we must eat less. Why should we unnecessarily overburden? Whenever we go with friends in offices and everywhere, and we say snack there, we pick up a little bit, it accumulates to huge during the day. Similarly, in parties or anywhere else, we overload our system so much that it hardly gets utilized, especially when everybody has a car and everybody walks around in buses and etc. So the golden rule is eat less. And let me add it, you eat less at the night. If you have to eat, you eat during the morning, during the day, but after, at night you eat very less. Don't overburden your system at the night. No doubt it may be difficult initially, but when we eat less during it becomes a habit, and then it will take a lot of care of the body. It will reduce the body's this sugar and extra sugar level in the blood, and if in case some sugars or fats are stored in the body, that will be utilized during the night. Number first. Number second, we have to change the lifestyle. I forget to tell you that if we take the medicines on the fatty liver, and if we abandon those medicines and we don't change our lifestyle, then the fatty liver can recur. Because it's not possible to continue with the medicine forever, and you know that all medicines have side effects. So apart from the medicine, if you take medicine for a few months, but you have to maintain the lifestyle, the same lifestyle which you used to maintain while taking the medicine. And one of the best things to maintain the lifestyle, as I said, first is to eat low, is to eat foods that are low in carbohydrate, that are low in sugar, and that change the lifestyle. And essentially, the best thing is to do the exercise, and best exercise is walking. Every doctor, every scientist is of the opinion that walking is one of the best exercises, and it can also reduce the visceral fat. You have to walk at least 3 to 4 kilometers per day, and that will take care of your sedentary lifestyle. That will take care of the many aspects of health aspects of your body. That will also, as I have personal experience, it is very beneficial even for the prostate gland, and it will help in maintaining the health of the prostate. So walking is the best exercise. So please take walk continuously, daily, regularly, at least 3 to 4 kilometers per day. If you can do more, better. And avoid the foods such as foods with high sugar, high carbohydrate, these junk foods, and too much fried foods, and too much meat, too much starchy foods. As I said in the first video, you have to reduce the intake of the fruits, because it is as I said in the first video, the first fructose which gets converted into the fat in the. So please, we have been taught since the childhood that fruits are very essential. They contain antioxidants, they contain so much vitamins, they contain this much. But as I said in the first video, nowadays the fruits are often loaded with the medicines, fruit and artificial ripeners, etc. And besides, even if they are not loaded with these toxic elements, certain fruits contain fructose, which when in excess can get converted into the fat. So it is better to take the fruits also in moderation. And also we have been told to consume large number of dry fruits. These should also be taken in moderation, especially raisins. Raisins are they contain very high amount of this easily assimilable sugars. So one has to take these in moderation and change the lifestyle. So let's wind up this video. So let me conclude. First thing is to eat less, especially at the night. Second is to avoid excess of carbohydrates, excess of sugars, excess of especially the refined sugar, and excess of fats, excess of these dry fruits, and excess of sorry, not fats, excess of fruits and excess of these dry fruits. Besides, one must walk at 3 to 4 kilometers. And before commencing any treatment for belly, it is essential that you check your lipid profile, and in case there is high triglyceride level, you have to consult your doctor for the medicine on the track, because triglyceride these medicines taken for the triglyceride usually take care of the fatty liver. So please share this video among your near and dear ones, and subscribe to the channel. Thank you very much.